Welcome everyone to our panel discussion on improving access to home dialysis and barriers we see within the African American and minority communities that prevent the use of this modality. We will also be discussing the factors that drive the uptick of new cases of kidney failure and challenges we are seeing during the COVID-19 pandemic. Today, we have 4 panelists who we will be hearing from. First is Dr. Robert Kosman, Executive Vice President and Chief Medical Officer of Fresenius Medical Care North America. Dr. Kosman has been with Fresenius since 2014. He is a practicing nephrologist with over 2 decades of working in the field. Dr. Kosman trained at the University of Washington and received his Doctor of Medicine from Case Western Reserve University. Next, we have Joe Turk, the President of Home and Critical Therapies for Fresenius Medical Care North America. Joe's been working in the home dialysis industry since 2000, when he joined Next Stage Medical, which develops, produces, and markets products for home dialysis and intensive care. We also have Dr. Kazat Jamison, a nephrologist with over 20 years of experience as a private practitioner and an advocate for home dialysis. Dr. Jamison is a medical director of a home program in DC and has a small private practice, the Metro Renal Association, with offices in Washington, DC and Maryland. Finally, we will also be hearing from Donald Ferguson. Don started dialysis treatment at the young age of 24. During his time on dialysis, he spent 4 years doing in-center treatment and 2 on home dialysis. On February 24th, 2014, he finally received his kidney transplant. Don currently works for Next Stage as a patient consultant, helping to educate fellow patients on their home therapy options. He lives in Florida with his wife, Alexis, and 2 daughters, Sarah and Ava. According to the US Renal Data System, as of 2017, there are over 740,000 Americans suffering from kidney failure. Unfortunately, African Americans are about 3 times more likely to develop kidney disease. As an integral part of the provider community and with Fresenius's long history of innovation in the industry, we are continually looking at ways to transform how we can care for people living with kidney disease. Government policies should be oriented towards slow progression of chronic kidney disease and avoiding the preventable underlying chronic conditions that lead to it. Amongst the topics we will be touching on today will be prevention and what should be the ultimate measure of success. When kidney failure occurs, transplant should be the first therapy option and is the best option for fulfilling our mission of improving the quality of life of our patients and our promise to give them their lives back. Today, we will hear from Don Ferguson, who received a transplant and has firsthand experience about the process. When a transplant is not available, we believe the next best therapy option is home dialysis. Fresenius Medical Care has been very interested in improving the access on home dialysis and ensuring our patients have the best innovative technology that accelerates the use of home modalities, which benefit patients through flexibility, more energy, better sleep, fewer hospitalization, and overall improved quality of life. We will also be hearing from our experts what barriers African Americans face with home therapies and ways in which we are working to improve access and educate patients. Now I'll turn it over to our panelists. Dr. Kosman, can you kick us off with talking about some of the barriers you are seeing to home therapies within the minority communities?
Thanks, Talene, and I think that's a great place to start for today's conversation, and that's a pretty nice recap of kind of the overall landscape of things and some of our philosophy. Now, I would start by saying that when we talk about minority communities, we're talking about a very heterogeneous group of communities around the country. So most people figure out right away from looking at my style of dress that I'm not from the Washington, D.C. area, and I'm not from New York City. And I practiced for over 2 decades here in Santa Fe, New Mexico. And so our minority communities were primarily Native American, which made up 20% of my practice, and Hispanic. But in the role that I've had for the last year and last few years as Chief Medical Officer in Fresenius, I've once again had a much broader exposure to the different communities, including also African American and others. And what I would say is, we talk about these groups, it's really important to be thinking about your individual situation, or as a doctor, your individual patients and this individual that's in front of you. So we have some sort of geographic heterogeneity as well, in terms of rural versus urban and different parts of the country. But I think one of the things that we can generally say is there are real concerns about access to care. The ability to actually get ongoing medical care at early stages of kidney disease, as you mentioned. One of the things that we're most interested in is preventing people from developing kidney failure and treating their kidney failure, treating their kidney disease or kidney injury at early stages. But this involves having access to care. And so, some of the factors there may be socioeconomic, but our country has many different challenges to overcome. And with some of our communities, some of those are cultural sensitivity and trust issues. So in other words, how good am I as a doctor in understanding the person that's in front of me and being able to communicate with them and making them feel comfortable that I'm understanding of their personal circumstances and sensitive to their needs. When we begin to talk about barriers, so in addition to actually, the ability to get access to care, to have somebody who's going to create that bridge, that communication, we then also get into issues that are around the economics, such as housing, food security. And when we talk about housing and home dialysis therapies, we have quite a bit of flexibility in how we can help patients potentially be able to do dialysis in their home, whether they're in an urban setting and have a smaller footprint for where they live, or in a rural setting where there may be some issues with delivery of care. So I think that, I bucket things in these general kinds of categories. And a theme throughout here is being able to reach individual patients, to be able to talk to people, communicate and educate, and then be able to understand how to problem solve for those folks. So maybe I'll pause there.
Sounds good. Maybe we'll turn to Joe and sort of talk about some of the policies on the federal level that could be changed to make home therapies more accessible, and sort of talk about some of the work Fresenius has been doing to accelerate the use of home dialysis.
Well, thanks, Talene. I really appreciate the opportunity to join today and share some thoughts. As you said, I started in home dialysis about 20 years ago, so it's been a long-term passion to try to do the best we can, and it's even become more exciting as next stage that developed technology joined with Fresenius. So let me start with your second point about some of the work that we're trying to do and some of the things that we've accomplished, and then get back to the first point about what are some things that can be changed at the federal level. So it's as I mentioned, it's been a really, really exciting time to be at Fresenius with respect to home. We're in a really unique position as both a medical products innovator and also an innovator and leader in providing kidney care services around the country and around the world. And we're really innovating in home, and we're starting to see the results of that. Over the last year, we've had about a 15% growth in patients at home, doing their dialysis at home, and a really amazing 40% increase in the number of patients that are doing hemodialysis at home. And so the overall dialysis population is growing, but it's growing at about a 2 to 3% rate. So 15% and 40% is pretty incredible, and it's been great for patients. Home obviously allows the ultimate in personalized care, engaged treatments, on one's own time and their own terms. And it's also really been shown to improve quality of life, increase transplantation, decrease medication costs, reduce hospitalizations, and extend life. And I know Don's going to talk here in a little bit, and he can share some of those experiences. But it's really it really can be a win for the for the right folks. And And Fresenius has really been committed to innovating in this, and we've done a lot, and I don't think it's overstating to say that we've done more than anyone else in the world, and we're going to continue to do that. I'm going to focus, there have been a lot of things we're doing, don't have enough time to talk about all of them, but the biggest thing that we've been doing is focusing on education. There's nothing more important than education in supporting choice. We know that most healthcare folks, personnel, would choose home for themselves, and they obviously know quite a lot about it. And then we also know that when the time is taken to educate patients, their loved ones, their family about home, the percentage that will actually choose home increases dramatically. And that's really, really important because it doesn't always happen. Today, half of patients don't even know they're going to be starting dialysis before they start, and that can be even higher in the urban and minority communities. So we've been making pretty significant investments in trying to improve education. One of the things that we've been doing is something called the Transitional Care Unit, or a TCU. And simply, this is a different way to start dialysis. It's a different first 4 weeks of therapy with very, very much focus on personalized care and education of options. And it's really exciting that when people go through that program, about half end up choosing home, which is much, much higher than what happens normally without it. So really, really important. We're also really investing in other resources to make sure that people have the opportunity to learn about dialysis. We have a program called Kidney Care Advocates, KCAs. There are about 200 of those folks around the country. They're nurses, social workers, dietitians, and others. And they really focus on making sure that people before they start dialysis know about options, and then also once they start. So that's been a really, really important program that we've expanded over the last couple of years. And then we have what's called our Patient Advocate Program. And again, Don can talk more about that. But those are individuals that were either home patients or partners of home patients that are either doing therapy or have been transplanted. And there's nothing better than sharing personal experiences, so people can understand, is this for me? And so those are some things on education that we've really been doing. And we've also invested a lot in telehealth. And one of the things that's really come through with the pandemic is folks have realized, just embrace telehealth as a way to communicate better and deliver better care. So this is something been very, very important in the last few months. And these all of these things have been really, really critical for increasing access to patients and their families all over. Obviously, what the federal government is very important to dialysis and dialysis options. And there is the right mindset. There have been a number of things over time that were at least intended to support home dialysis. There's always things that more things can be done. And for Fresenius, we're excited about the intent of last year's executive order to really improve access to transplants and to home dialysis. And we look forward to kind of evolving with that going forward. But there are some specific things that we really think could be helpful. One is value-based care. Value-based care really empowers all of us to deliver real change for patients. And that includes increasing the rates of home dialysis and transplantation and to deliver cost savings to the Medicare program. The current structure, the fee-for-service structure, naturally has some barriers to doing what would be really logical at times. And things like delivery of the education and coordinating care amongst providers can be harder in today's system. So we really are big supporters of what we can do to deliver real change with value-based care. I also mentioned that telehealth was really important for home dialysis, and during the pandemic, it's been we've learned a lot, and patients have really benefited from it. This flourished during the pandemic because of a series of waivers that allowed us to do some things that we would not have been able to do in a normal world. So making some of these waivers long lasting, such as allowing home to be the originating site. There are some other geographic restrictions that exist are really important. And there are also, there are some other things that could be really helpful. Telehealth is naturally done using video. You know, we're doing video, not telehealth, but talking about telehealth on video right now. But there are certain situations, rural environments, and some underserved populations that sometimes the bandwidth to support video just doesn't exist. So there need to be guardrails, but there are important times where something other than video, voice would really help with home dialysis. As a rule, we really believe that recognizing socioeconomic barriers, housing insecurity, insufficient insurance, limited family support, these can be real barriers to home and under the current rules. And we're not always able to address these in the current structure. Value-based care and some of the telehealth comments that I mentioned really help with that. But as a general rule, we need to be thoughtful, as we think through things and minimize these so we can maximize access and minimize access disparity. So in summary, Fresenius, Next Stage, all of us, we're really committed to growing home and embrace the intent that the federal government has shared. Next to transplant, we truly believe there's no better option for patients than home. And we're going to continue to work hard to make it more accessible to everyone. And we can use all the help we can get.
Makes sense. Dr. Jameson, Joe mentioned that education was very important, especially when choosing home and also for prevention. You run a home clinic and have been working in the DC community to help patients with chronic kidney disease slow their progression to kidney failure. Can you share your experience with what you're seeing on the ground and seeing as far as getting patients to stay in home, stay choosing home therapies as an option?
Yes, yes. Joe was on the money. Education is going to be the primary way in which we can get patients to choose home. So let me say this. Thank you for the opportunity to share this from a physician's perspective, practicing physician's perspective. By the time the patients come to see me as a nephrologist, a specialist, they're a little scared. They've been sent there by their primary care doctor, and now they're sitting up and taking notice that they have chronic kidney disease. And this referral is probably one of the best things that a primary care doctor can do for their patient. Because sometimes when they can't get through to the patient to take seriously the kidney disease, once they sit in my office or once they know they have to come to see me, the fear makes them ready to be a little bit more adherent and a little bit more serious. So the first thing I do, my first visit usually will take an hour. I'll sit down and we'll talk about chronic kidney disease and where they are in particular and what it means for me to help them to slow the progression of their disease. And that means that they need to adhere strictly to their medications to control their blood pressure and to control their hypertension, their diabetes if they have it. And I mentioned those two diseases because those are the two primary diseases that we see that cause chronic kidney disease in our people of color, in the population that I see, mainly African American. And it is actually the same for minorities in New Mexico, where Rob practices or used to practice. There are other diseases, and we certainly look for them if they are not, if it's not obviously hypertension or diabetes. And so when we talk about slowing the disease progression, we talk about educating them as to how they can control the blood pressure and take care of the diabetes. And one of the major factors in controlling these two things is learning how to eat properly. So I stage the disease with them. I tell them, this is where you are. I show them the lab work that they have. And I'm showing them the computer screen that we are following. And this is where it was 6 months ago. This is where it is today. And this is how it will progress or not progress if certain things are adhered to or not adhered to. In the education process, Rob mentioned family members need to be there because patients hear better if they have a family member that reinforces and said, yes, the doctor did say that or not say that, and how we're going to work together. And especially if it's a man, I love to have the wife come in so that we can talk about the food. And I'm coming back to the diet, because this is going to be a big part of how you're going to slow the disease progression. She needs to learn to cook with less salt. And she needs to remind him that he can't have that extra slice of cake, and, you know, and these kinds of things. And it's easier to have somebody in your court when you're trying to manage your weight or manage your diet than to try to do it alone. Educating them, I have a passion for cooking. I enjoy cooking myself. And I think that if people can learn to cook healthily and deliciously, that they're more inclined to follow the restrictions that the physicians put on them. And sometimes they just need to be shown a few things. So we developed some cooking classes, and I did it mainly for my dialysis patients in one of our dialysis facilities. But I have invited some of my office patients to come. And you know, it's really been something that people have enjoyed coming together. It's a fellowship sort of thing. And before COVID, it was wonderful. And patients were able to come, and we would cook together and taste the food, and they'll say, oh, this is not so bad. I mean, it sounded like it was going to be awful, but it's really good. I'm originally from the Caribbean, as you can hear. So of course, you know, I like to add a lot of seasonings and little jerk here or there to my foods. And you know, it's spicing and making your food with lots of herbs and different vegetables can be delicious. And that's what I try to educate patients about, because the vegetables are going to be a big part of how they're going to eat healthily. So this chronic disease progression can be slowed. It can be slowed, but it has to be in a concentrated effort between the patient and the physician. We have to have a pact to work together. We have to be having frequent visits. My patients with chronic kidney disease are being followed by me every 3 months. And I'm trying, when they come in, to praise them, to find something to be positive about, because they can feel down. They can feel as if, you know, I've tried so hard and it's not happening. And there are times when I've had to have come to Jesus talks, and I've had patients come back to me and say, Dr. Jameson, you were really hard on me, but that did it. When you told me that I was going to X if I didn't do right, it made sense. And, you know, they finally saw the light and started to do better. And that's very gratifying to me when I hear that I've been able to reach a patient. And there are times when I've had to say, I am sorry I'm so hard on you today. And, you know, because they react strongly, and it's like, you didn't say this to me, did you? I said, yes, I'm sorry, but I needed to let you know that it's time to take things seriously. The empathy between the physician and the patient is very important. They need to know I care. And so I spend the time to talk with them. I think the frequent visits reinforce what they're doing and the information that they hear. And sometimes they hear it the first time, it doesn't click, and you need to hear it again a second time, a third time, before it makes sense and before it brings the effort. I think as physicians, we cannot give up on our patients. We know that we're dealing with a population that has to overcome a lot of barriers of feeling a little bit threatened, feeling that you're not on my side, that you're in it to take advantage of me and to put me on dialysis. When I get my patients to trust me, it's the most important thing. I think that's the first barrier that's obliterated, when they trust me and feel that I'm on their side. And I think the only way to do that is to make sure you spend time with them and they don't feel that you're rushing through the visit. So it does require effort, and it requires investment. And I think that once we have that investment and effort, patients listen, they trust, and then they can effect the changes they need to effect.
Thank you so much for all that. I'd like to turn it to Dawn now and sort of hear your experience with home dialysis and your experience with being a transplant patient, and also how you're doing today.
Oh, well, thank you. And thank you for letting me be a part of this. This is really exciting. But I was definitely, when we're talking about the theme is education, and I was definitely an incidental patient and had no formal education about dialysis, what kidneys do, or anything like that. So I was definitely one of those hard-headed men that did not go to the doctor or found out anything that was wrong. I thought I was Superman and everything was just fine. And honestly, how I found out I was sick in the first place was I was going to work. I was working as a chef and I was doing a lot of hours. So I was just always tired. And I thought it was from work. So it just got to the day that I just couldn't keep anything down and it just didn't feel right. So I ended up calling my girlfriend, who happens to be my wife now, and we talked about it and I said, you know what, I'm just gonna leave work and we're gonna go to the hospital. And she knew it was okay, it was something wrong because I never leave work. So we went to the hospital and we sat there and it was taking forever to have them call me to the back. So I was just like, you know what, I'm being a big baby. Let's leave. And I could just go home, lay down for a little while and I'll be fine. She was like, you know what, no, we've been here for a little while. So let's just go ahead and stay and wait. So I listened like I should. And like 5 minutes later, they ended up calling us back to the back. So the nurse hooked me up to the blood pressure cuff and she took my blood pressure. My blood pressure was like 200 over 200 and something. So she just like freaked out. It's like, okay, go to the back. So I went to the back. They hooked me up to the EKG machine. They took blood work. They took urine. And they were willing me out to go do a full body scan. And the nurse just stops me and she's like, you know what? We got your lab work back. Your labs are all over the place. So we really don't know what's going on. So you need to call whoever you need to call and let them know you're not going anywhere. So my wife had already left at this time because we had our 8-month-old at that time and she went to go check on the baby. So I'm alone at the hospital, 24 years old. They're telling me they don't know what's going on. So finally the doctor comes in to give me my diagnosis and he's like, you know, we took your body scan, we're looking at the images and we only see actually one kidney. We don't know if you were only born with one kidney, but that one kidney you have is only working at 8% now. So you're gonna have to do dialysis treatments tomorrow. So I'm sitting there like, okay, what is dialysis treatments? Because I've heard the name before, but no one's ever really sat down with me and explained to me what a dialysis treatment was. So he explains to me, you know, they're gonna put you on a machine, they're gonna take your blood out, they're gonna clean it, they're gonna place it back. I was like, okay, sounds pretty easy. But I was like, you know, should I get a second opinion about this? Because, you know, I'm 24, I don't know anything that's going on. Just like Dr. Jameson said, I just feel like, okay, what are you doing? Are you just trying to put me on something? And he was like, well, you can get a second opinion, but he's gonna tell you the same thing. So I was like, okay. So we both sit there with this awkward look on our face because I could just see it in his face, like he really didn't want to tell me this. So I was just like, well, it was nice to meet you. And we just both bust out laughing. And he was just this great doctor who gave me all of his information and he helped me out so much. But in the hospital, they mentioned home dialysis to me. But at the time, that just, you know, I'm already dealing with so much. And to me, that sounds like a luxury. So that's something I can't do. So lo and behold, I go and I sit in a center for 4 years. And no one ever really took the time to come sit down and really educate me on home dialysis. And so one day what happened was I took my daughter to preschool and me and the receptionist developed a relationship as friends because her son was going through a similar situation as me. He was around the same age, he was on dialysis treatments. So we stayed in contact just because of those reasons. So one day she seen me in the hall and she stops me after I was about to leave from dropping her off. And she was like, you know, my son, he just started doing home dialysis. He feels so much better. He can eat now, he sleeps better. And it's something I think you should really look into. So I was like, well, if someone said it to me, maybe I should really look into it. So I went and I spoke with my my charge nurse at the center the next treatment. And I was like, can you have someone come and speak to me about home dialysis? She said, sure, of course. So in a week, I had the KCA, which Joe Turk was just talking about, came out and spoke to me about home dialysis. She introduced me to both therapies. I went for the home hemotherapy. I thought it was awesome. Even though you had to stick yourself, I was like, you know what, I'll still try it. So luckily at the time, when I was going out for it, someone was being trained. Well, they were in the pipeline for being trained. Luckily, they got a transplant, so I got thrown into their spot. So within a week, I was being trained for home dialysis. Within that week of training, I was so upset because no one came and sat down and told me about this. And I sat in this center for 4 years and didn't know I could do this at home because it made me feel so much better. It was like night and day. So I kept telling my trainer nurse, like, something has got to be done because this is crazy. Because I go to a center with 145, 150 patients, and none of us know about home dialysis. So she introduces me to the representative for Next Stage in the Florida area. And we went and we did something called a lobby day, where a lobby day is where I would go and I would sit down with patients, I would tell them my story, and basically educate them on home dialysis and how home dialysis helped change my life. I went to that same center where I came from and did a lobby day. They were training patients for like 2 years after that lobby day. Because no one knew, and they just couldn't believe how I came back in there and I was just so full of energy, hopping around. It was like, what are you doing? So I went and I talked to them about home dialysis. I answered all the questions and everybody was like, okay, I want to do that. And since then, that started this whole journey, and I did that with him for like the next 4.5 years until finally Next Stage brought me on as a patient consultant, and now I get to do it as a job, where I get to educate patients and help them and give them all that knowledge that no one was able to give to me, which is such a big present to me, I would say, because at this point in my life, like, I feel that I actually appreciate getting sick because I wouldn't be the person that I am today and wouldn't be able to give back this gift of being able to give that knowledge back to other patients. So that's how it affected my life anyway. No, thank you.
Well, I mean, it's a great journey, and sort of, I guess it leads me to my question to you of what advice you would have for resources for people who just get diagnosed with kidney failure, or if they have any family member that's been diagnosed.
Well, I would definitely say education, just like they were saying, because when you're educated actually about home dialysis, a lot of myths that you would hear in the centers about, I heard about my cousin, he did home dialysis and then he passed away. When you really don't know the full story of what happened with your cousin, just because he was doing home dialysis does not mean that he passed away from home dialysis. So just breaking down a lot of those myths and misconceptions that a lot of patients have, where they already feel like they know what it is, when you don't know what it is. And just knowing that if I can do it, trust me, anyone can do it. It is just something that you just have to take full control over and get that independence back. Because I've noticed, speaking with as many patients that I speak with, independence is that key that's always missing. And home dialysis gives you that key back. And they just don't realize that it's right there for you and it's right at your fingertips. You just have to grab it though.
Definitely makes sense. And with our theme of education, I sort of like to open it up to all of you to sort of talk about how has it been educating our patients during the COVID pandemic, and how have we been able to, sort of accelerate the progression of home therapies.
This is Rob. I'll maybe offer the following comment and then toss it maybe to Dr. Jameson and to Joe Turk. The education is something that we also work to educate the healthcare providers in our clinics and our physician partners. So we've actually taken a very active role in trying to help make sure that dialysis clinic staff and physicians have access to ongoing training and education programs. And we have an ongoing program, the Advanced Renal Education Program, which we offer to healthcare professionals. So they don't have to be doctors, but we encourage doctors and nurses and patient care technicians across the country. They don't even have to work for Fresenius. The faculty is faculty that's drawn from clinical practice, all of whom have expertise. And that helps us begin to address a little bit of the problem Don brought up about the fact that many patients in the center may not have been getting the opportunity to hear again about home dialysis. In his story, it came up early, didn't seem right early, and then there was a missed opportunity with a long gap of 4 years before that awareness came again. And so some of that also is something that we can help with by addressing with some of the, some of what we do with the staff. But I know Dr. Jameson, and you could tell from when she was speaking, she's not just a passionate person, she's a person who makes those connections and builds that trust. And, we heard that word trust a couple of times from Don as well. And I think that's so key. And so, because maybe I'd turn it over to you, and then I know Joe probably has some good comments for us, as will Don, about some of the efforts we're making with patients.
So I don't think that COVID has been so bad in terms of reaching our patients, fortunately, because of the ability that we've had to do things like this. Like, I use Teams in my office, and patients actually are happy to talk with you on the phone if they don't feel that comfortable with the technology. But I know that patients who have been afraid of coming out are happy that they have the option to talk to me. And so I think we still have moved forward with keeping in touch with them. I tell them, the first thing they ask me, so how are my labs doing? And I say, this is how it compares to last time. And the first few months, they were a little bit scared to come in, and we kept using the Teams and we used the telephone, and we were able to bridge the gap that way. And now they're coming out. And truth is that a few people who were afraid to come out, I put 3 people on into the home therapies clinic, started PDE, started that's peritoneal dialysis, and then another started the home hemodialysis like Don does just last month, because they were ready, they were brewing, and they stayed away even though we were able to get some blood work, we saw that things were gradually getting worse, but they understood that things were progressing, and they were not afraid. When it was time to get on the machine, they were ready to go. So we were able to quickly move forward because we were able to still keep in touch with them during the COVID crisis. And so I think having the technology to talk through Teams or through Zoom is really important, and to keep things going so that patients still understand and hear, and if they can get their blood drawn, because they're also afraid of going to the hospital. They don't want to go to the hospital. They will get their blood drawn. You can check it. You can see what's going on and communicate with them. The surgeons have been working with us. If we need to put accesses in, as long as the COVID test is negative, they can come in to have their surgeries done. The hospitals work with us. They understand our patients need to have attention and not be pushed aside. And I think everybody's working through to get the patients the care they need. And that's been very successful from my end.
I'll add a little bit to this. I think that clearly the pandemic has created its own challenges. Things like to start dialysis, whether it be home hemodialysis or peritoneal dialysis, there's a need for access to be able to do the therapy, and there were some challenges with securing access. But a lot of work by a lot of people was done to resolve that. But I think from an education perspective in particular, there were three things that work to support interest in education and home dialysis. First of all, it was really logical to people why doing therapy at home would be a really good thing in the situation. And so, everybody, not everybody, but people were more generally seeking information. So that was a good thing. Second thing is for patients like Dawn that are in the dialysis center, we're in the dialysis center. The staff at the dialysis center can be really important and really helpful in making sure that people know about the options. And I would say that the dialysis center staff also embraced how home dialysis could be really helpful for patients and good for patients in the pandemic, and really helped with that and increase the education. And then third is, back to video and telemedicine. A lot of education was face-to-face, person-to-person, and during this and during the pandemic, we really embraced virtual communications and virtual lobby days. And so that were much less dependent on logistics and scheduling and traveling. So I would say because of new skills in education that we learned and being open to new forms, more people were able to learn about home dialysis options. So there were some real things that helped with education that came out of this pandemic period. Don, what do you think?
I would just definitely say any patient that is looking for information on home dialysis can definitely come and talk to any of the patient consultants. All you have to do is just Google next stage patient consultant, and you can go right ahead and you'll get one of me or one of my other counterparts, which we are willing to talk to any patient about any therapy, whether it's in-center, home dialysis, whether it's hemo, peritoneal, whatever. We're definitely comfortable and we love doing our job anyway. So it's just like having another conversation with us.
Great. Well, we have a couple minutes left. Does anyone want to give sort of a closing remark? I just want to thank you all for joining us, but would love to hear one last remark from anyone that would like to jump in.
I'd like to offer a compliment to Don, Joe Turk, and to Dr. Jameson. I think it's really a privilege to be with a panel of folks like this, and I also really want to say that there's a huge commitment on the part of those of us who are a part of this panel, but on the part of Fresenius Medical Care broadly, to help people with kidney disease at all levels. And I want to go back to where you started for us in the review. There's a lot of kidney disease in the United States. It's, depending on which numbers you look at, it's upwards of 30 million or more people who are affected, most of whom don't know it. And we'd like those folks to get treated so their kidney function is preserved so that they don't ever need dialysis or a transplant. As a company, we're committed to kidney transplant and have made significant strides and donations to some nonprofit organizations like Donate Life America and the National Kidney Foundation to promote kidney transplant. But for those patients and for family members who do ultimately need dialysis, we are the world's largest provider of dialysis services and the world's largest provider, or rather manufacturer, of dialysis products. We make the best. We try to provide the best care, and we think that home therapies really have a lot to offer. And you don't necessarily need to take it from me as the doctor. You just have heard Don tell a story that is powerful and moving and positive. And so I just want to offer my few closing words there, and I'll turn it over to anyone else who would like to make a comment.
I'll just follow on real quickly. There's there's a lot that's been done, but there's a lot left to do. And to the extent that anybody has additional ideas or needs or some suggestions on how we can better serve the community and patients, please reach out. We are very committed to making change, and would welcome any thoughts that folks have.
Great. Well, thank you, everyone. I think we have run out of time, but I really appreciate each one of you taking the time to chatting with us today. And have a wonderful day.
Thank you.
Thank you very much.
Thank you.
Thank you.
Bye-bye.
Bye-bye.